Greetings and welcome to week 5. I hope you all are having a wonderful week and enjoying the class. We are getting towards the end. So last week in week 4, we discussed addiction, competencies, and stereotypes and bias. And you had both a discussion as well as believe it was a paper, and you may hear my little person in the background. But you had a discussion as well as a paper to help you dig a little bit deeper into the different biases and stereotypes that can come up in terms of treatment outcomes, as well as reflect on your reactions to the addictions population. In your discussion, there were many common themes around biases, stereotypes, ethical responsibilities of addiction providers and counselors when working with individuals diagnosed with um, substance use disorders. Some of the kind of more specific things that you all noted was addiction counselors may have bias regarding different identities of their clients, and can often perceive clients with substance use disorder as untrustworthy or hopeless. And so we want to be mindful that we're checking those biases. We want to be mindful that we aren't using stigmatizing language such as dirty or user. It really attaches this level of moral judgment to an individual rather than recognizing the substance use as a mental health disorder as we would for like a heart disease or something like that. In terms of the impact on treatment, biases can really be intertwined into everything that we do. So intakes, assessment, diagnosing, treatment planning, and having bias in these kind of, sorry, y'all, these kind of environments within someone's treatment can be a huge detriment, as it can really lead to misdiagnosis, missing something within treatment, and them not getting the specialized care that they are deserving of. Lastly, there are many ethical considerations, especially when we think of cultural competence using that lens to look at ethics. So we've talked about NADAC and ACA, so being mindful and emphasizing the responsibility of the counselor to provide services that are non-discriminatory, with a culturally competent lens, and also addressing any personal biases that a counselor may have. In addition, uh, it is important that as a clinician, we are always educating ourselves and engaging in consultation, supervision, having a diverse team with diverse thoughts so that you're able to also address these key biases as well. This week, we're going to be tapping into learning about vicarious trauma and burnout, which some folks may be familiar with. There are different terms that you might hear. And so thinking of vicarious trauma and burnout as two different things, with vicarious trauma referring to the emotional and psychological impact from hearing a story from others, from seeing things within the field or in counseling that causes this trauma through something, right? Vicariously. And then burnout is an emotional exhaustion, depersonalization, and it can be common in high stress areas, and it's often over a long period of time. Sometimes it's a shorter period of time, depending on kind of what the level of exhaustion is, but it is something that can happen, and it is very common in our field. So it's important to mitigate against that. So some of the signs and symptoms of vicarious trauma are perhaps some intrusive thoughts related to client's trauma, emotionally numbing oneself, it then impacting personal relationships and their self-care. And then some signs and symptoms for burnout are physical and emotional fatigue, not being satisfied with the job, and a reduction in productivity. So some risk factors to consider for burnout are high caseloads and chronic exposure to traumatic stories. So not only having a majority trauma caseload, but also a high level of clients that you might be seeing, not having support or supervision in order to bounce ideas off of and really seek that validation and support that we need, and then having poor work-life balance and self-care practices at all. Now, how it can impact a clinician is they may have a decline in their level of empathy for clients. They may make really poor decisions in their service of care, and they may be absent or may want to overall leave the profession, which oftentimes, if burnout is not addressed, that is what can occur. A clinician will leave. So some ways that clinicians may be able to mitigate that is through self-care or wellness. So making sure we're having good boundaries, we're engaging in hobbies, seeking social support, whatever it is that makes you and brings you joy, you're doing those things. Making sure that you have professional support. So a clinical supervisor, peer consultation, debriefing sessions, maybe engaged in group supervision. And then lastly, organizational changes. So within the organization, making sure that the promotion of a healthy work culture is promoted, and then having resources and also making sure that clinicians are using their time off. This week, you have a number of different readings that will focus on vicarious trauma and burnout. You also will review the professional quality of life measure scale, which you have both the actual scale as well as you can score yourself. This will lead into your assignments for this week, which is a discussion board discussing vicarious trauma and burnout, and then using the professional quality of life scale in a reflection paper. So again, hoping that it's been a good time in the class, that you're enjoying it. Please feel free to reach out if you're having any kind of difficulties or need some assistance, and I'd be happy to help. Have a wonderful week, and I look forward to seeing your work.